This is not a Scotty dog. But let's talk about the Scotty dog and why it's important. Let's do a quick rundown of the Scotty dog, the medial branch, and the facet joint. One of the most important pieces of anatomy for those going into pain medicine. So, the Scotty dog is just basically an anatomical portrayal that looks like a Scotty dog. So, it is made up of the ear here, which is the superior articular process. The nose, which is the transverse process on the involved side. The leg, the front leg, the inferior articular process. The body, which is the spinous process. And lamina. The neck, the pars, interarticularis, or the piece between the two articulations, the superior facet and the inferior facet. This is where young adolescents coming into your clinic with back pain, you have to suspect pars interarticularis fractures. The eye, which is the pedicle. The back leg, which is the contralateral inferior articular process. And the tail, which is the contralateral superior articular process. So this is what makes up the Scotty dog. So it's important for facet joint pain. You're trying to block the medial branch in facet arthropathy. The medial branch innervates a facet and the multifidus. So it's not just purely sensory, it actually has some motor component. It does only one multifidus, it does not do the one above or below. So the only one, it does one at that level. Versus when it innervates the facet, it actually innervates the facet joint at that level and it will descend to hit the one below. So facet joint, it is one facet joint is innervated by two separate medial branches. That's important because you don't want to just block this medial branch without blocking this medial branch. Otherwise, the patient could still present with pain and you have a false negative diagnosis of facet joint arthropathy. So, coming off of the spinal cord are the spinal nerves. So this would be somewhere in here. Beneath this pedicle is going to be your dorsal root ganglion. Then the ventral ramus, primary ventral ramus is given off here. We don't care about that. And the dorsal ramus is given off here. We do care about that. So, since this is the this would actually be underneath that pedicle because each nerve root, this would be the L2 nerve. The nerve goes underneath the pedicle. So the L2 nerve is going under the L2 pedicle. So coming off of this L2 nerve root is going to be your primary dorsal ramus, and off of that is going to be the medial branch. So this is the L2, L3, or sorry, this is the L1, L2 facet right here. This L2 nerve root is going to wrap around and lay right on this spot right here, and innervate this facet joint. It will also have a branch that descends and go to the L2, L3 facet. That's why you have to block the level above. So each facet joint is innervated by that level and the one above. What does that mean? The L2, L3 facet is innervated by the one at that level and the one above. So the L1 and L2 medial branches innervate the L2, L3 facet joint. When you're gonna block a facet or a medial branch, because that's the procedure you're gonna do before you do any others. So on an AP view, looking down at the patient's on the table prone. So you're looking down at the patient. You're targeting just at the 3 o'clock position of the pedicle right here. So because this right here is where that nerve lays or lies. So you're trying to aim the needle just like this. On the oblique view, which is the Scotty Dog View, which is 30 degrees of oblique tilt of the C-arm. So instead of having the patient turn to their side to get this view, we just turn the C-arm while the patient stays still. So aiming the needle right here would be the same as aiming the needle right here. As we said, that nerve will leave this, we're talking about, we're using the L1, L2 as the example. The spinal nerve comes off, gives off a ventral ramus that goes anteriorly. This posterior one will wrap around and lay right here. This one will wrap around and lay right here. It will also have a branch that descends and comes right here. So to anesthetize this L2, L3 facet, we're going to have to block this one to block this descending branch, and also block this one to block the nerve that's innervating at that level. That's why you must do 2 blocks for 1 facet. And that is the same here. This is what it would look like on a coronal view. Your needle would be right here where that nerve is coming out. This is the posterior ramus. This would be your ventral ramus, which we're not worried about. And coming off of that dorsal ramus is the medial branch. That's coming like this, and then it'll go down to the one below to innervate that one. Just as a quick quiz and refresher, the L1, L2, right here, facet, gets innervation from the L1 medial branch and the T12 medial branch. The L2, L3 facet right here receives innervation from the L2, L1 medial branches. So you always are going to block, let's say L4, L5. You block the number that's on top and the one above it. So always block the first number of the 2 that are making up that facet. That is a quick and dirty rundown of the Scotty Dog, the medial branch, and the facet joint.